All right, I think we'll get started. Good afternoon and welcome to part 2 of the tobacco prevention series hosted by NYU Langone Health's Community Health Worker Research and Resource Center in partnership with NYU Langone Health Smoke-Free Community. My name is Dina Pimenova and I am the project coordinator for the Community Health Worker Research and Resource Center. Thank you for joining today's session titled Addressing Tobacco, E-Cigarettes, and Alternative Products with Youth. Next slide, please. Before I introduce our speaker, I would like to go over some housekeeping. Everyone is currently on mute. There will be parts of the presentation where your engagement will be asked for, so please feel free to go off of mute then. But just to make sure that things run seamlessly, please stay on mute throughout the presentation. The chat box is open for questions and comments and sharing of resources. We will have time to answer as many questions as we can during the Q&A portion. Slides and recordings will be made available at a later date, and please be sure to fill out our evaluation questions at the end. I am pleased to introduce today's speaker, Dr. Achala Talati, the Director of the Tobacco Policy and Programs Unit at the New York City Department of Health and Mental Hygiene. Dr. Talati is a board-certified preventive medicine physician and internist. She completed her public health preventive medicine residency at DOHMH and her internal medicine residency at Albany Medical Center. Dr. Talati also holds a Master of Public Health in Epidemiology and Biostatistics from the CUNY School of Public Health and Health Policy. Dr. Talati has led clinical initiatives at the health department that focus on increased education for the provider community and equitable access to care for all New Yorkers. As director of the Tobacco Policy and Programming Unit, she managed the implementation of the city's 10 tobacco bills passed in 2017 on issues such as retail licensing, retail density, hookah, and e-cigarettes. She also oversaw the local response to the e-cigarette or e-vaping associated lung injury EVALI outbreak in 2019 and manages ongoing surveillance for EVALI in New York City. I would also like to introduce Binh Luu, who will be moderating the Q&A discussion following the presentation. In her current position, Binh is the research coordinator for the tobacco-free community based in the NYU School of Medicine, Department of Population Health. She collaborates with community-based organizations to address high smoking rates among the immigrant population in the Lower East Side, Chinatown, and Sunset Park. And with that, Dr. Talati, the floor is yours.
Thank you so much. Really excited to be here with all of you today. And thank you so much for spending this time with me. And this is obviously a topic that's near and dear to my heart, but appreciate you giving me this chance to share more about it. So this is just an agenda of what we'll be talking about today. We'll spend a little time on understanding current youth use, including looking at some local data. Then we'll talk about background and health risks for different types of products, mainly because I want you to feel sort of well equipped to talk about them with clients or patients and feel like you can share health information. And then we'll speak a little bit more about, how to actually address product use with patients, including anticipatory guidance or preventive counseling and screening and treatment. So before we look at some of the local data that I mentioned, I kind of wanted to put that in context of tobacco industry activity over the last century, since that's really driven a lot of what we see. So smoking didn't really become popular until the early to mid 1900s. And that was as a result of industry innovations like the match and improvements in mass production and networks for widespread distribution. But it's also the first time that the industry engaged in mass media advertising. And you can see some of the examples here. So they targeted women as they were gaining social status in society. Cigarettes were actually given away for free at times to those in the military, and they even had ads that featured doctors. And then as time passed and we got to the mid 1900s, more information started coming out about the risks of smoking, especially the potential connection between smoking and lung cancer. And so smoking started becoming a little less popular around that time. And this is an image of one of the early scientific pieces that discuss that connection. And then, sort of in response to that decline, the industry decided to develop new marketing strategies and tactics. And one example of this was the rise in aggressive promotion of menthol cigarettes. There were actually vans that distributed free cigarettes. There were promotions for store owners and customers, which the industry sponsored. And you can see text from an industry memo here, which actually shows the president of a tobacco company saying that they were focused on specific communities and including high school students. And unfortunately, this sort of targeted advertising worked. We've seen, especially among Black adults across the country, although in the 1950s only 5% of them smoked menthol cigarettes, it's now 85%. And then by the late 1990s, the attorney generals of a lot of the states actually sued the tobacco companies for compensation of tobacco-related medical costs paid for through state Medicaid budgets. And it's because of that agreement, the master settlement agreement, that companies had to pay certain funds to states, but also that's where a lot of the restrictions around marketing to youth for tobacco products come from. So this is why there's no longer tobacco ads on billboards or transit or marketing with cartoon characters and things like that. It's because of the master settlement agreement. And then now we have the rise of e-cigarettes and other emerging nicotine products. And although e-cigarettes were invented in the early 2000s, they didn't really become widely available in the US until about 2010. But we've seen that the industry has adopted a lot of the tactics that the tobacco industry used in the past. So to look at that a little bit more closely, you can see that marketing of these products to youth is really persuasive, but also even aggressive or almost predatory. And the industry, really has used some of these manipulative strategies, including marketing campaigns, but also things like flavors to promote their products. And in addition to those things, they've also used some other tactics that the tobacco industry has used in the past, like offering discounts or coupons, which can make products more accessible to youth, and really sort of normalizing products. So if you look at all the ads on this slide, who are these ads really trying to target? What age group are they trying to target? And I think flavors also have been one of the top reasons youth have used e-cigarettes. The flavors can make the product seem appealing and harmless, even though they're not. And now actually the sale of flavored e-cigarettes is prohibited in New York as of last July, but their availability over the last several years has really fueled this epidemic. And social media has also played a big role. The industry's taken advantage of a lot of different platforms, including YouTube. On YouTube, there are a lot of videos that are actually just reviews of specific products or types of products or flavors. I also wanted to point out that the industry's taken advantage of the COVID-19 pandemic to promote their products too, sometimes trying to frame them as a coping mechanism to take a break from work or school at home stress, or even giving away products like masks, even giving away things like masks with their products. So now let's take a closer look at some of the data. If we look back at smoking among public high school students in New York City, you can see that in 2001, it was 17.6%. And because of a lot of things I mentioned earlier, including policies at the local, state, and federal levels, like smoke-free era laws and things like the Master Settlement Agreement, there has been a lot of success here. So since 2001, there's been a 72% decline in youth smoking among high school students, to 5% in 2017. But at the same time, you can see that aside from cigarettes, high school students have continued to use other products, including smokeless cigars and cigarillos and e-cigarettes, of course. So if we compare 2017 to 2001, you can see that although smoking, which is in this like magenta color, declined significantly, the rate of e-cigarette use is now like 3 times that of smoking. And then also use of other products like cigars or cigarillos has stayed about the same, or smokeless products has actually increased over time. And so you can see that e-cigarettes are really threatening a lot of the progress that we've made. And especially, all of these use of all of these products, since they all contain nicotine and can normalize tobacco use, is concerning. You can also see that this total rate, so sort of use of any product, is not just all these individual rates added together. And that's also because like dual use or use of multiple products is common as well. And then in 2018, we actually had middle school YRBS data for the first time. And we found that 1 in 15 middle school students, or 6.7%, reported using e-cigarettes. And as you can see from this graph, similar to high school students, e-cigarette use in the teal was much more common than cigarette use in the magenta among middle school students. And additionally, e-cigarette use was also higher among older students. You can see it's 9% and 8.4% among 7th and 8th graders, compared to only 2.6% among 6th graders. So there may be, sort of a transition happening around this time. And then we also now recently have 2019 YRBS data for high school students. And you can see that current smoking and e-cigarette use actually both decreased since 2017. Cigar use stayed about the same, and smokeless actually wasn't asked this year. And then I also wanted to include current cannabis use here. It's similar to e-cigarette use, and it has been in this 15 to 17% range for the last several years. And it is really important to keep cannabis in mind. As we'll talk about more, cannabis and tobacco are often used together, or even with the same devices when we think about vaping, which was particularly relevant for the Valley outbreak, which we'll come back to later. And then what about hookah? So overall, you can see among middle and high school students, 7.2% reported ever using hookah. And you can see that it's definitely more common among high school students. And just for comparison, only about 1.9% of adults 21 and older said they smoked hookah in 2016. And so this is concerning because there are a lot of misconceptions among youth that smoking hookah is sort of a safe alternative to other tobacco products, even though it's not, which we'll talk more about. So I just wanted to pause here and sort of see from you all, like, does this align with what you see in your communities, or anything that you found surprising or interesting, or just if you have any questions about the data that I just shared, I'm happy to answer questions before we move on to the next section. So someone said that it was interesting to see the data and trends, so that's great. If anyone else has any questions, feel free to unmute yourself. Otherwise, I'm happy to keep going on. Okay, great. So, there are a lot of misconceptions, like I just mentioned, about these products. I think especially for e-cigarettes, as well as hookah and cannabis. So I wanted to spend some time talking about each of those types of products, including how they're typically used and their health risks. And then I'm also going to speak about combustible tobacco. I know that's information that you're probably pretty familiar with, but I think it's a good point of reference, especially when we talk about vaping. And most of the information that I'm going to cover is in our product guide for pediatric providers. So that's a good reference in the future. It goes through like each category of products, including terminology and names, general information and health risks, including for a couple types of products, smokeless products and heated tobacco products, which we're not going to cover today. Those are a new category of products that was recently developed by the tobacco industry. So I'm happy to take questions at the end about those or follow up with people afterwards if there's any interest. But this is the product guide I mentioned, so that can be a great reference afterwards as well. So before we get into any specific products, I just wanted to spend a little time on the health effects of nicotine itself, especially since it's a risk for youth across many of these products. And we'll talk more about nicotine content and specific products in a few minutes. But as you know, nicotine is very addictive, and it is approved by the FDA to help people quit smoking, but not in the form of e-cigarettes. And it's never recommended for people who've never used tobacco, especially youth. And unlike nicotine medications, no e-cigarettes or other products that I'm going to talk about have gone through so similar drug trials to show that they help people quit. Also, the adolescent brain is still developing, so youth are actually more susceptible to developing nicotine dependence than adults are. And nicotine can also change the chemistry of the teen brain. It can affect learning by worsening memory and concentration. And then being exposed to nicotine through the mouth, skin, or eyes can be toxic. And children and adults have been poisoned by swallowing e-liquid. So like I mentioned, I did want to spend a little time here because although these are health risks that you're aware of, I think it's a useful point of comparison when we talk about e-cigarettes and vaping. So, in terms of combustible tobacco, we traditionally think of cigarettes, but I just did want to, highlight that there are also cigars, cigarillos, and little cigars. And the main difference here is that the products are wrapped in brown paper that contains tobacco, but the attendant health risks are really the same. And these products were also not as closely regulated at the federal level. So even after flavored cigarettes were banned, flavored products of these types were still available. And although now in New York City, the sale of flavored cigars is prohibited, a lot of little cigars are still wrapped in paper that contains artificial sweeteners, and that can make them more appealing to youth and young adults. And then also, little cigars and cigars are often just hollowed out and emptied of the tobacco and used to smoke cannabis, i.e. a blunt. So the health risks of smoking are primarily due to what's in cigarette smoke. So let's start with what's in a cigarette itself. So a cigarette is filled with shredded and reconstituted tobacco that's been processed with various chemicals. And then there are multiple additives for preservation, but also to add flavoring and make the smoke less harsh. And then after all of this is put together, it's filled into a paper tube that has a filter at one end. And then when you light a cigarette, the process of burning what's inside of it, including the tobacco and other additives, generates over 7,000 chemicals in the smoke, including over 60 carcinogens or cancer-causing chemicals. And so you can see a few examples here of some of the chemicals in cigarette smoke and other common substances that they're found in, like formaldehyde, which is also an embalming fluid, or carbon monoxide, which is also in car exhaust fumes. And the combination of all of these chemicals in the smoke results in really wide-ranging health impacts. So you can see here that smoking impacts nearly every organ in the body. And I think we often think first about lung cancer and COPD, but smoking can cause over 10 types of cancer and many chronic diseases, including stroke, diabetes, and even autoimmune disease like rheumatoid arthritis. And we're also still finding new associations. So every disease that you see here that's listed in red were added in the 2014 Surgeon General's report. So, we're still finding out about some of these health effects even now. And then I also wanted to take a minute to specifically talk about secondhand smoke. So starting with the definition, secondhand smoke is a mixture of two types of smoke: the smoke that comes from burning tobacco products themselves, like the lighted end of a cigarette or a cigar, and the smoke that's exhaled by someone who's smoking. And there's no safe level of exposure to secondhand smoke. Even being exposed to small amounts can potentially have negative health effects. And you can see some of those health impacts here. For children, secondhand smoke increases the risk of ear infections and respiratory infections. It also decreases lung function, which means higher risk of asthma attacks, and it can also cause SIDS, or sudden infant death syndrome. And for adults, secondhand smoke exposure can cause stroke, heart disease, lung cancer, and other health problems. And so now let's move on to e-cigarettes. So what about e-cigarettes? What's in an e-cigarette? And this is a little bit more complicated than a cigarette because we're really talking about thousands of different potential products. But let's start with some of the basics. So they come in many forms, but they all contain a heating device that turns an e-liquid into an aerosol. And we do try to use the word aerosol and avoid vapor, both because it's more accurate, but also because vapor is often associated with water vapor, and that can perpetuate that misconception that these products are harmless. And so e-liquids usually can contain nicotine, flavors, and other chemicals, which we'll come back to. And you may have seen the different types of devices pictured here, including larger devices like tanks and mods, and smaller USB-shaped devices like Joule. And tank devices usually come in different sizes, but they have a chamber or tank that you can refill with any type of e-liquid. And then pod-based systems typically come with pre-filled pods, but are now open or modifiable pod-based systems as well. And then there are also single-use or disposable e-cigarettes. Some of these look like an actual cigarette, like you can see here, and others which have been more popular recently look similar to pod-based systems. Regardless of the type, there are a lot of different terms that people use to refer to e-cigarettes, which can be confusing. But vapes and vape pens are other names for e-cigarettes, and using an e-cigarette is often called vaping. Also, because Joule became so popular, it also sort of became its own term. So using a Joule is often called Jouling. And so I know we discussed different types of devices, but I wanted to spend a little more time on that just so you're familiar with different products and feel comfortable talking about them. Once Joule became really popular, so this is an example of a Joule starter kit with the actual device and 4 pods and a charging system. A lot of companies started developing similar pod and cartridge-based devices. So you can see a couple examples here, Miley, which looks almost exactly like Joule. There are also a lot of companies that sell pods that are compatible with Joule, sometimes even empty pods that can be filled with any type of e-liquid. And the other 2 devices on the slide are different Sorin products. They're both relatively small and thin, so both of these could actually slide into a pocket, but they don't come with pre-filled cartridges. They actually have sort of a cartridge like this. The top of this device is kind of like a cartridge that can be filled with any type of e-liquid. And like I mentioned, disposable e-cigarettes or vapes have become popular, and this was partly because there was a federal policy that was focused on cartridge-based devices like Joule, and these devices were excluded. And so although early disposable devices did often look like a cigarette, you might remember blue that had the lighted blue tip. They now often actually look similar to Joule or vape pens. You can see some examples here on the bottom. All of these are different disposable products. And they all also contain, similarly high concentration nicotine e-liquid, which we'll talk about a little bit more soon. And these are also easy to use because they don't require any charging or refilling or purchasing of separate components. And so all of these factors can make them more appealing to youth. Another thing that I wanted to mention about tank devices, so these are some examples of different tank devices that you can see on the bottom, is that they often have a higher voltage or the voltage can be modifiable. That's why they're called mods. And so because of that, they actually produce a greater volume of aerosol. And so that can make them popular for doing vaping tricks and making shapes with the aerosol. So when we're trying to understand what's in the aerosol from e-cigarettes, we have to start with the e-liquids. And this is a little hard because the specific ingredients of e-liquids are not really closely regulated. And that includes the concentration of nicotine in each product. No one is really making sure that what companies say is in their product or how much of it is what's actually included in the product. But there are some usual categories of components. So first, there's a solvent. This is usually a mix of propylene glycol and vegetable glycerin. Propylene glycol is actually what's used to make fake smoke, like at concerts or in the theater. And then next, there are flavorings and other additives. There were over 15,000 recorded flavors in 2017, and there are probably even more available now. A lot of these flavorings are compounds that are safe to eat, but not necessarily to inhale into your lungs as small droplets. And then it's also important to remember that these liquids are being heated, and that heating process may generate other chemicals too. And then finally, there's the nicotine. And the nicotine content can also be pretty variable. So a lot of the older products had nicotine content that was between 8 to 20 milligrams per mil. And that's partly because it can get irritating at concentrations above that level. Nicotine's actually naturally basic, and most of the early e-liquids included nicotine as a free base. So if we think about the pH scale where 7 is neutral, nicotine by itself as a free base, the pH is between like 8 to 8.5. But that's changed more recently. So you may have heard of nicotine salts or salt-nic. And this was actually one of Joule's main innovations. So instead of including nicotine as a free base, they added some acids like benzoic acid, which made the nicotine into a salt and easier to tolerate. And because of that, they could increase the nicotine concentration. So like I said, the old products had concentrations between 8 to 20 milligrams per mil. They increased it to almost 60 milligrams per mil. And that's also an important difference to keep in mind between the US and other countries, especially in Europe and the UK. There, the nicotine content is actually capped at 20 milligrams per mil. So now that we've talked about what's actually in the liquid, what happens when you heat it. So that heating process, there's some chemicals that are probably always in the aerosol. So that includes nicotine, but also things like formaldehyde, which is generated from heating these typical solvents, propylene glycol and vegetable glycerin. But formaldehyde is also carcinogenic. And then the other chemicals in the aerosol can vary because the e-liquids themselves vary so much. But there are potentially other carcinogenic chemicals like benzene, things like diacetyl from flavoring, which is linked to lung disease, and heavy metals like nickel, tin, and lead. So comparing to cigarettes, what are the effects on the body here? And, unfortunately, I can't show you like an image with specific health impacts like I could for cigarettes. Even though we know that the aerosol can contain harmful chemicals, unlike cigarettes, we don't actually know what the long-term health effects are of exposure to the aerosol, mainly just because the products haven't been around for that long. Some early studies do suggest potential concerns, including for lung disease, but there are really only a couple of longitudinal studies so far. One short-term health concern is airway irritation and cough, which is a known potential impact of glycol and glycol mist from one of the main solvents in e-liquids. And just to think a little bit more about the long-term health effects, like if we think back to what we know about cigarettes, it took us decades from the time they became popular to really demonstrate that smoking caused lung cancer, and even longer to find out about other health impacts, like cardiovascular disease, diabetes, and colon cancer. So we'll probably continue to learn more over time, but it's hard to know exactly, what all those risks are right now. We do now have data, though, from over 20 longitudinal studies that show that youth who use e-cigarettes are more likely to later try cigarettes. We don't know yet if they actually go on to smoke long-term, but that's concerning. Defective batteries in some e-cigarettes have also caused fires and explosions, and those have led to serious injuries and a few deaths. And then, of course, there was also recently a national outbreak of e-cigarette or vaping product use associated lung injury, including over 50 cases and at least 4 deaths in New York City. And we'll come back to this more when we talk about cannabis. And then e-cigarettes are also harmful to the environment. So you can see a picture of Joule pods here on the sidewalk, which is something I'm sure you've seen outside too. In addition to the plastic waste, there can be electronic components or e-waste, especially for the disposable products that we talked about, because there you just throw the entire thing away. And then there are also the traces of nicotine e-liquid, which is actually considered hazardous waste. And then I also wanted to mention secondhand aerosol. The definition is a little different because unlike a cigarette, where there's also smoke that comes from the lit end, there's no aerosol that's released secondhand directly from the device. It's all aerosol that's been exhaled by someone who's vaping. And again, we don't know what the health effects are really here either, but people breathing in the aerosol secondhand are exposed to the same chemicals that we just talked about. And so unfortunately, I can't show you an image here that explains exactly what the effects are on the body. But another secondhand risk that I did want to mention too is just sort of the behavior of everyone around a child or adolescent, including peers, siblings, or other family members. That's something that we know has an impact and is a potential risk factor for future use. And then I also wanted to share a little bit about smoking, vaping, and COVID-19, while also noting that the research here is still evolving, especially regarding vaping and use. But the area where we have the most research is regarding smoking and severe illness. So we do know that smoking increases the risk of severe illness with COVID-19. There's less literature around vaping, but since we do know that vaping can cause lung injury and may affect lung health in other ways, vaping may put you at increased risk for COVID-19 illness. And I think it's also important to keep in mind the social context in which vaping happens. Vaping socially often means sharing space, not wearing a mask, or even sometimes sharing devices. And all of those things can increase risk of COVID-19 exposure. So that's something to keep in mind too. And then I wanted to move on to hookah. So a hookah or a water pipe uses burning charcoal to heat shisha, which is a flavored blend of herbal substances. And tobacco is a popular and common ingredient in shisha, but there is some shisha that's tobacco free. Regardless of the tobacco content though, it's never a healthy alternative to cigarettes. But how this works is the shisha is placed in the bowl at the top of the pipe, and it's covered with foil and burning charcoal. And then when someone inhales through the mouthpiece and hose, air moves past the burning coals and it heats up the shisha. And then that travels through the water base and that cools the smoke down and makes it feel less harsh. And so data shows that there are a lot of misconceptions, including that the water in the water base filters out all the harmful chemicals, and that it's a healthy alternative, especially when it doesn't contain tobacco. But that's not the case. We know that actually, regardless of tobacco content, hookah smoke contains toxic chemicals, including carbon monoxide, particulate matter, which is linked to decreased lung function, heart attacks, and cancer, and formaldehyde, which is carcinogenic. And the water in the pipe doesn't effectively filter out all of these chemicals. In fact, only 1 hour of smoking hookah, which is really only 7 to 8 minutes of actual, puffing or inhaling time, can expose someone to more carbon monoxide and tar than smoking 10 cigarettes. And the carbon monoxide levels in hookah smoke can actually cause carbon monoxide poisoning. There have been several reported cases here in New York City. And secondhand hookah smoke is also hazardous. So everyone in a room where hookah is being smoked is exposed to the same chemicals. And that's something that's been demonstrated in studies of non-smoking employees at hookah bars, as well as children at home where hookah is being smoked. And then finally, I wanted to spend some time talking about cannabis. So you can see some other names here for cannabis or marijuana. And THC, or tetrahydrocannabinol, is the psychoactive compound in cannabis that produces the feeling of being high. And then CBD, or cannabidiol, is another compound in cannabis, which is not psychoactive. There is one medication that contains CBD that has been approved for treatment of epilepsy or refractive seizures. And then, as we know, the legal status of cannabis is really evolving, including here, with multiple states and local jurisdictions, decriminalizing and legalizing cannabis for adult recreational use. And this may have contributed to national data that suggests that teens' perceptions of cannabis harms have actually declined in recent years. So what types of products are we talking about? So cannabis can be smoked, including with tobacco, like in a blend, like we mentioned earlier, and also used via joints or water pipes, which work in a similar way to a hookah pipe. And it can be consumed via food or edibles. And then it can also be used with e-cigarettes using a cartridge with oils and concentrates. And some of these THC concentrates, like the ones you can see here, wax and shatter, are actually solid or have the consistency of more like honey or butter. And because of that, to vape them, they have to be thinned or diluted with other ingredients to be in a liquid form that can be vaped. And so there are some potential health risks you can counsel patients on for any forms of cannabis. And so you can find all of these in our product guides, but just to summarize, short-term cannabis use can impair memory and ability to retain information, and it also increases risk of motor vehicle accidents. Long-term, frequent or long-term use is linked to lower educational achievement and can also increase risk of experiencing psychotic symptoms, especially for those with psychotic disorders. And if smoked, patients can also experience cough, asthma, and bronchitis. And cannabis smoke does contain some toxic and carcinogenic chemicals like carbon monoxide, particulate matter, formaldehyde, and benzene. And metabolites of some of these chemicals have been found in children exposed to secondhand cannabis smoke at home, but the long-term health implications are still unknown. And generally, we do just know less about the long-term health risks for cannabis, and that's partly because of its legal status, it has been more difficult to study. And hopefully that's something that's starting to change. So recreational cannabis vaping products are not yet legally available in New York City. So I think this is one place where the ingredients are actually completely unregulated because it's an illicit market. And this is something that became evident during the recent Valley outbreak. One of the things that we saw during that outbreak was many counterfeit products that were designed to look like recreational products from other states or products with design packaging. So these are some examples. So these two products on the side, Kingpen and TKO, are actually products that are available for recreational use in California, but we saw that there were a lot of counterfeit versions of them here in New York City. And then these other products here, chronic carts, dank carts, exotic carts, even though the packaging looks like, it's a brand and it's centrally manufactured somewhere, it's actually just, there's empty packaging and cartridges that are available for sale online. And so people can just purchase them and fill them with whatever they want and resell them. And so a lot of these products are what we saw implicated during the Valley outbreak here in New York. And so to talk a little bit more about Valley in more detail, the initial outbreak peaked in September of 2019, and the injuries themselves varied. There were some people who required, no or minimal oxygen support. There were people who had complete respiratory failure and required mechanical ventilation, and there were even a few deaths. And during the outbreak, there were over 2,700 cases nationwide, including 60 deaths. And most cases were among young men, although cases ranged from early adolescents to older adults. And that really matched what we saw here in New York City. We saw similar sort of age range and demographic. And here we had over 50 cases and at least 4 deaths. And most of these cases did seem to involve cannabis use with a strong link to vitamin E acetate, which was found in some of the cannabis e-liquids. And this was sort of confirmed using a study that the CDC did, where they looked at bronchoalveolar lavage fluid samples from people's lungs who had a Valley, and they compared them to a healthy comparison group. And vitamin E acetate was one of the only chemicals that was consistently found among the cases. And so this was in products because it was actually being used as a diluent to dilute or thin the THC wax so that it could be filled in cartridges and be vaped. So you can see a couple examples of vaping cartridges here. Although vitamin E acetate is something that we know is safe to eat or apply to the skin, it's in a lot of food and skin care products. We found that it was definitely not safe to inhale. But I also wanted to emphasize that no single compound was linked to all cases, and there may actually be multiple causes. About 10 to 15% of cases at the national level, as well as here in New York City, reported only using nicotine products. And this was verified chemically sometimes, like people had a negative urine drug test for cannabis. So it's still, an ongoing concern for anyone who vapes potentially. And there are some ongoing cases nationwide, including here in New York City, although they're at a lower level. So I know we covered a lot of information about a lot of different kinds of products. So I just wanted to pause for a couple minutes and sort of recap a few points. We're going to do a couple multiple choice or sort of quiz questions, and feel free to use the chat to guess which answer you think is correct. So first question, using which of the below could expose a student to carcinogenic chemicals like formaldehyde or benzene? A cigarette, an e-cigarette or a vape, a joint or blunt, or hookah with non-tobacco shisha. So I'm seeing a lot of Bs, which is kind of correct, but this was a little bit of a trick question because it's actually all of them. So all of these products can potentially expose people to carcinogenic chemicals. We know sort of the most about that long-term exposure for cigarettes, and I think we're still learning more about the rest of the products. So next question. Which of the following products is available for sale now at New York City retailers and has closely regulated ingredients? Nicotine vaping products, CBD vaping products, or THC vaping products? So I'm seeing some Bs, but also a couple nones. So a couple of people who've caught on to my trick questions. And that's correct. It's actually none of them. So nicotine vaping products and CBD vaping products are legally available for sale at New York City retailers, but neither currently have closely regulated ingredients. And right now, THC vaping products are only available for recreational use on the illicit market. There are some products that are in the medical program that are available through that program, but for recreational use, the ingredients are probably really not regulated at all. And so they're likely even more variable. And final question, and this one I promise only has one correct answer. So which statement below is incorrect? Youth who use e-cigarettes are more likely to try cigarettes. E-liquids do not contain tobacco. A few e-cigarettes are approved by the FDA to help people quit smoking, or one Joule pod can contain the same amount of nicotine as a whole pack of cigarettes. So I'm seeing a lot of C's and then a couple of B's and D's maybe as well. So the correct answer is C. This is the one that's not true. The rest of these are. There are no e-cigarettes yet that are approved by the FDA to help people quit smoking. And then I also wanted to pause here in case anyone had questions about specific products, because next we'll move on to more, sort of how you can address product use with patients or clients. So in case anyone had any specific questions about products, happy to answer those now. Okay, I'll just keep going then. So now that you know more about these products and their potential health risks, what can you actually do in your regular sort of day-to-day practice and work? So I wanted to spend a little time sharing key principles for anticipatory guidance or preventive counseling, screening, and treatment, along with some resources. So these are our key recommendations for pediatric clinicians, and we have a toolkit or an action kit that's built around these recommendations. And I know you might not be working in the clinical setting, but I wanted you to get a sense of what our key recommendations are, for providers across the age spectrum. So one thing is that screening for secondhand smoke or aerosol exposure is something that's important at all ages, really. And we do have some resources to help counsel refer parents or family members, especially since we know that seeing family members use tobacco products is a risk factor for future use. There's also a letter that we have that you can send to a patient's landlord or management company, sort of recommending a smoke-free policy. And then preventive counseling or anticipatory guidance should really be provided for all school age kids. So starting as young as 5. And for younger kids, this can be really sort of quick and more broad. And for older kids, it can be more in-depth. And then screening for use should really start around age 10, especially given the data I shared about middle school use. And then at all ages, findings should be addressed with patients and families, including counseling, pharmacotherapy when needed, and follow-up. So this is the action kit that I mentioned, which has several sort of clinician facing as well as parent and youth facing resources, which we'll touch on. And in addition to the product guide, which I mentioned, one resource that I wanted to highlight is the guide that we have on anticipatory guidance, screening, and treatment. So this includes guidance on how to counsel patients at different ages, as well as parents, including examples of the types of things you can say about different products. And then it also has algorithms on how to screen and treat parents or family members, as well as youth. And it links to some of our other materials. So I just wanted to share a few key principles from this guidance document today. So one is in terms of, what should you focus on when you're counseling different age groups? So for elementary and middle school students, we've found that it's effective to focus more on short-term or immediate health effects, including potential for addiction, any personalized health risks. So for example, if someone has asthma or something like that, as well as marketing manipulation. So this is one example of something you could say that's focused more on the potential for addiction. Trying vaping a few times could get your body hooked and make it harder to stop. And then for high school students, you can still counsel on all of those things I just mentioned, but it can also be more effective to counsel on intangible risks too. So that includes things like financial costs and potential long-term health effects, as well as secondhand risks to those around them. And so here you can be a little bit more expansive and discuss potential long-term health effects, even the fact that they're unknown. So, vaping aerosol has a lot of chemicals in it, including some that can cause cancer. Each flavor and liquid can have different chemicals in it with different risks. It took us decades to realize that smoking causes cancer. We don't know yet what the long-term health effects are from vaping, but that means that e-cigarette companies are basically experimenting on you. And then there are also some materials to help you with this. So for middle school students, we have this Don't Get Hooked comic book, which follows a group of friends through a few different scenarios in the city. And it covers a lot of health information, as well as things like industry manipulation. And it also references different types of products, including cannabis. And for high school students, we have this fact sheet as well. And for parents and families, we also have this pocket coaching guide, which covers the basics, including frequently asked questions, and it has tips on how to discuss this topic with kids. And then in case you do have any young adult patients or clients, these are a few other things that might be helpful. So this is a fact sheet on smoking, vaping, and COVID-19 that we released earlier this year. This is a health bulletin, which is pretty simple and straightforward about e-cigarettes. And then this is a letter specifically about Valley that has sort of recommendations for people who vape, whether they're vaping THC products or nicotine products. And all of these things that I've mentioned are available in multiple languages on our website. So for both youth and young adults, patients don't necessarily interact with the healthcare system as often. So it's important to ask about these products as often as you can. So these are some sort of key principles for screening and counseling. So one is just, make sure you ask and counsel during preventive visits. When you're screening for use, ask both about broad categories and specific products to give examples, and then counsel about risks. All of the short-term exposures and risks and long-term risks that we talked about today are in our product guide for reference. And then in addition, right now, Valley and COVID-19 might be helpful framing mechanisms to bring up the topic since they're particularly relevant. So to look at this in a little bit more detail, like I was mentioning, you can ask about a category like vaping with some examples. So, have you ever tried vaping with a vape pen, Joule, or other device? What about vaping cannabis or THC? And you can ask about smoking in the same way. Have you ever tried smoking cigarettes or cigars? What about smoking cannabis or a blunt? And you can also consider opening the conversation by asking about sort of peer or friend, use of these products as well. If there's no use, it's a good opportunity to provide positive reinforcement and reiterate some of the health risks. And the same applies if they have relatively infrequent use, like once or twice in the last year. If there is regular ongoing use, then it's an opportunity to assess for nicotine dependence. So that means, tolerance and a need for increasing doses, as well as withdrawal symptoms. And you can see some of those listed here. And if you do have concerns about cannabis or another substance use disorder, then you can also consider referral for substance use evaluation or psychiatric services. But if there is nicotine dependence and someone is open to treatment, you can counsel by reviewing any lessons learned from previous attempts to stop or just to reduce use, and really discuss, potential challenges or coping strategies. So things like changing routines, distraction tools that can be helpful when you have cravings, and avoidance, especially of specific situations or triggers that were associated with use for that person. And there are some more detailed suggestions about this in our coaching guide on smoking cessation. So this was developed more around smoking cessation, but I think these sections would be particularly helpful, even in this situation. And then you can share resources. So 2 accessible free options are This Is Quitting, which is a texting support program that was developed by the Truth Initiative. And people who enroll get tailored messages and support based on their age and the products and frequency of usage. And then there's also the Quit Line, which provides unlimited patient-initiated coaching or counseling. And for young adults, they could also potentially get a free starter kit of medications. So let's talk about medication options in a little bit more detail. So potential medication options would include nicotine replacement therapy, or NRT. And this is usually the most effective when you use combination NRT, which means using the long-acting patch with the short-acting form of NRT, like the gum, lozenges, nasal spray, or inhaler. Since these medications are only FDA approved for those 18 and older, they can be considered on a case-by-case basis for those under 18. That's currently the American Academy of Pediatrics guidance as well. But because of that, they would need a prescription to get any of these products, even the forms that are normally available over the counter for adults. And then the other options are bupropion, like Zyban or Wellbutrin, as well as varenicline or Chantix. And you can see our prescribing chart, which has a little bit more detail on, contraindications and side effects, although that's, really built around smoking. But for those key pieces, they would be the same. The dosing is a little bit more challenging, since it's harder to gauge exactly how much nicotine people are using every day, but I'm happy to talk more about that if people have questions. And then it's also important to tailor the strategy to the patient. If someone's really not ready to quit immediately, you can consider a more gradual approach. Nicotine replacement therapy is safe to use while someone is still smoking or vaping, so that can be a great option, even for someone who's not ready to quit completely. Maybe it can help them in specific situations, like when they're in places where they can't vape, to build their comfort and familiarity with the medication. And so here you can see some of the other materials that we have that can support screening, treating, and counseling, including the coaching guide and the prescribing chart that I mentioned, as well as the letter to landlords or building managers. And these are some other educational materials that we have either for patients or clients, as well as for you if you're interested in local data, or, this is an article on guidance in clinical practice. And so all of this is available on our webpage for clinicians, and this kit and the materials inside of it are highlighted at the top of that page. And like I mentioned, several of the sort of public-facing materials are available in multiple languages, and can also be ordered via 311 if you want to have copies available for people. And that is everything I have. So happy to take questions. I know we're running out of time, but I'm also happy to stay on a little bit longer if people have questions.
Thank you, Achala. That was a very informative presentation. We did have a few questions that was sent when doing registration. One of the comments that was during your presentation was you don't see a lot of smoking, youth smoking cigarette. As a result, you don't really think there's an issue with tobacco concern in the youth. But there was a few questions revolving around conversation with youth. One question was, if based on conversation with the youth, sound like it is the pressure to fit in, how can you begin to address this? Would the goal then be to help build the youth self-esteem or confidence? That was one of the questions.
Yeah, I think that's exactly right. I think it's similar to talking about other things. I think sometimes it can also be helpful to really emphasize that this is an age when like your brain is still developing, and you don't have to decide about these products right now. You can sort of wait until you're older, to decide about not only these products, but also things like alcohol. Like this is a time when your brain is still developing. And so you're more at risk for it affecting you in ways that, you may not be able to reverse as much over time as like for adults. So that can be something to help emphasize. I think also in general, if you have like one big conversation with kids, that can be kind of scary. But I think the more you can sort of bring it up regularly over time, that can be helpful and make them more comfortable asking you questions as well. So I think here, since we're in the city, it can be even something like when you're walking past a vape shop or a smoke shop, that can be like a good time to bring it up. Or if you happen to see an ad for one of these products, in the neighborhood around you, that can be a great sort of conversation starter to bring up this topic. Or even if you see somebody vaping outside, that's a chance to sort of talk a little bit about what you know and ask them what they know and what they've heard. And there is more sort of like concrete advice about this in the coaching guide that we have for parents and families.
Okay, I mean, this is similar to what you presented a little bit, but what should be some of the first question that we want to ask youth who are actively smoking, without scaring them off, without like we're trying to be nosy about their smoking habits, but wanting them to quit?
Yeah, I mean, like I think it's always helpful to start with asking them about what they're using and how often they're using it. And then also just like, how do they feel about what they're using? Like, do they have any concerns, or, is there anything that they had questions about, to sort of open up that conversation? And then you can sort of go from there. And it is also helpful to always like ask permission too, I think, before you offer sort of information about health effects, like, are you open to talking about this today? Would you be willing to kind of talk a little bit more about this and some of the recent things that I've heard? Or are you willing to sort of I have some sort of like materials or like a fact sheet here, would you be willing to look at that? So I think all of those things can be helpful.
Okay. Well, one last question. This attendee said there are many Asian in my community using e-cigarette. I would love to have written material addressing the health benefit of quitting risks due to the language barrier, which makes it difficult to communicate. Does DOH have any material in Chinese and other Asian language that we can share with the attendees if they work with the Asian community?
Yeah, definitely. So I think any of our materials that are for adults, so like one of the things I mentioned was this health bulletin. This is also a fact sheet about smoking, vaping, and COVID-19. These are both available in Chinese. The health bulletin is actually available in sort of all the languages that the health department translates into. So those are great options for someone who's a little bit older, like a young adult or an adult. I think for kids, most of our information is only in English and Spanish, just because we've looked at sort of the data in terms of languages that kids speak. But if anyone has any specific requests, they're definitely let us know, and we're happy to translate things as well in the future.
Okay. Thank you, Achala. Please stay a little bit behind for a poll. We'll be sharing all the information from the part 1 and this as well. So we'll be sharing the slide, any resource that we will have from part 1 and part 2. So stay tuned for those emails. Thank you, thank you, Achala, and thank you everyone for attending. Please reach out to us if you have any more questions. You can email me or Dina or Achala, if you have any further question you have. I'm sorry, there's one more question. Are there any campaign to address tobacco use for youth?
Yeah, so there are campaigns from a lot of different groups. The health department here has done a campaign, and when we target something towards youth, it's usually mainly on sort of digital platforms. So we've had a campaign called Don't Get Hooked that we've run a couple times, but also sort of national groups like the FDA and CDC have had campaigns as well that have run in New York City. And then we've also had sort of more on the ground and sort of community engagement campaigns with local organizations as well in the past, especially focused on flavors.
Thank you.
And it looks like the poll is still open. So
Yes.
If people could fill it out, that would be great. We love having feedback to help inform any presentations in the future.
I always have there's another question. Any ideas to address youth who smoke from marginalized group?
Yeah, I think that's a great question. With e-cigarettes, when we look at the data, use was actually highest among white and Latino students, but that's not necessarily true. That's not necessarily true for other products. For example, I think cannabis products or cigars and cigarillos might be more commonly used among Black youth. So, that's definitely a great question. I think, one of the things from our perspective with the materials that we just covered is we wanted to make sure that you and other clinicians and providers and people who are interacting with youth feel comfortable talking about all of these products. And I think that's sort of been a gap in the past, especially with cannabis. A lot of people don't feel really comfortable talking about health risks, or they don't really feel like they know enough to speak to that. So I think that's something that we're trying to do more, and I think will be really important also going forward, since with adult use being legalized for recreational use. So I think that's something that we're trying to think more about too, how to reach specific communities and groups. We have a little bit, I think our data is also a little bit more limited for youth because it's just a smaller data set that we have for New York City than we do for adults. But we can't get into like sort of specific neighborhoods and look at differences, but that's something that we've definitely tried to do for adults as well.
I guess we'll give it another minute or two to finish. We'll close the poll in 2 minutes.
Yeah, that sounds great. Happy to stay on.
I did have a question of my own,
Yeah.
a little bit about the heat and not burn product. I know it's popular in other countries, but do you expect it to become popular in the US any day soon?
Yeah, that's a great question.
IQOS, yes.
It's definitely something we're concerned about. So I can actually pull up this slide. So this is one example in the middle of a heated tobacco product, IQOS, and you can see that it looks sort of high tech, which can be appealing to youth. And it's kind of being marketed in other countries as something that's sort of safer. Even the name actually stands for I quit ordinary smoking. That's what IQOS stands for. So you can see there's like a little bit of manipulative messaging there, even in the name of the product. It is available now in the US in just a few cities, but we think it's definitely something the industry is going to try to promote more. I mean, that's something that they've actually said, in interviews and stuff, that they're hoping to invest more in these types of products, and hope that they sort of take off more. In other countries, they've even sort of said that which is also sort of a manipulative message, but they've said things like, that they're advocating for like a smoke-free society, which means they want people to use these essentially instead of cigarettes. So it's kind of a manipulative message too, because they're still profiting from these products. But yes, I think it's definitely something that we're concerned about and are keeping an eye on.
So, I know like DOH is concerned about this. Are you, do you plan to have any campaign to kind of not educate, but to have awareness that this heated tobacco is going to be the next big thing for tobacco company to kind of like push in the market?
That's a good question. I think I think we're hoping to potentially update some of our laws, because this does fit into some of our existing laws, but there are a few places where there are probably gaps. And then I think you're right, we do need to increase awareness about them. So there is a section about these heated tobacco products in the product guide that we have. So that's one resource, for people like you who are working in the community, or clinicians in the community as well. But I think we probably do need to do more to increase awareness about these products too.
Achala, we have just one last question. After this, we will probably close. The last question is, what about vaping CBD oil minus the THC? Something new? Yeah,
I think it's one of those things where we just don't know a lot. And the other aspect is sort of, the ingredients aren't really regulated. So there are CBD vaping products that are available in New York City, like at local retailers. But there's not sort of the FDA recently sort of got regulatory authority over those products, but they haven't enforced that very strictly yet. So the ingredients in those products are probably even less regulated than the nicotine products. And so it's hard to know, sort of what the health effects are, because we don't know everything that's even in those products. So it's a little hard to say. And, like as we found out with the Valley outbreaks, there's some things that seem like they would be safe, like vitamin E. And then we find out that when you vape it, you can get a lung injury. So, I think that's the main concern with those products, just that we don't know as much about what's in them.
All right. Okay. Thank you, Achala, and thank you everyone for attending. Hope everyone have the rest of the good day. All right. Take care, everyone.
Thanks. Take care, everyone. I'll put up this slide too, in case anyone wants to contact us afterwards.